Hello, very good evening and a very warm welcome to yet another super amazing, super informative and a very interesting topic and episode of Curious Minds with me, Pritesh, your host, your host and a proud educator from Embibe. And today we are talking about joint pain versus arthritis. What exactly is a joint pain? What causes a joint pain? Where does a joint pain occur? What are the different types of joint pain and how can it be treated? And the same for arthritis. What is an arthritis? What are the types? How does it happen? What causes it? And how can you treat it? A very interesting and an informative topic. Make sure that you watch it till the end and make sure that you give this video a big fat thumbs up. Do share it with everybody around because it's very important that you understand what is the difference between the two, right? I've seen many people saying if their knuckles are paining, oh, I think I have arthritis. And the similar we discussed when we were talking about headache versus migraine as well, that you should not just talk about diseases without having proper knowledge of it. People just simply say I have depression, I have stress, I have anxiety, I have panic attacks, I think I'm bipolar, I'm schizophrenic. So you should not talk about such medical terms without having the proper knowledge and diagnosis of it. And similarly, today I have come to discuss about joint pain versus arthritis. So make sure that you watch this video till the end and take the information from it. And similarly, I have got this amazing Embibe page for you, which is completely free of cost and it gives you unlimited learning access, and it also gives you an immersive learning experience with free access to test, assignment, study material, question, solution, explanation to solution, books, reference books, NCERTs of any board, any grade, any subject and in any language. So make sure that you explore the Embibe page and you can also download the Embibe app, which is freely available on Google Store and Apple Store. And now guys, we are talking about joint pain versus arthritis. So you can follow me on my Instagram at Biology with Pritesh, connect with us on Telegram as well, and make sure that you are updated of whatever is happening on the channel. So let's talk about joint pain versus arthritis. So basically, joint pain is a joint discomfort which you feel at the joints. What is a joint? Where two bones meet. So it can be in the hands, in the feet, in the hip, knees or spine. Joint can feel stiff, achy or sore. You can feel that it is stiff, you're not able to bend. It is sore, extremely painful or achy. Joint pain may affect the function of the joint and can limit a person's ability to do basic tasks. Like many times I feel that, after I've had a long class, when I sit, I feel a slight discomfort in my lower back. After I have cooked, in the kitchen for say about an hour, and when I come and sit on the sofa, I feel a slight discomfort in my lower back, right? If I have not slept properly, if I've slept like a swastika, and when I wake up, I feel a slight discomfort in my, in my neck. So these are all different kinds of joint pain. These are all different kind of muscle pains, right? Who is more likely to experience a joint pain? Who have had joint injuries in the past. People who repeatedly or overuse a muscle. People who had rheumatoid arthritis or other persistent illness. People suffering from stress, anxiety or sadness, and people with weight problem. All of these, are more likely to experience a joint pain. What causes joint pain? Osteoarthritis is caused by the breakdown of cartilage which acts as a cushion between the bones. The joint begins to ache and become stiffened. So basically, at your joint, there is something that is keeping your joint very fluid and very smooth, and that is the cartilage. Now over time, this cartilage begins to wear out and the smoothness of the joint goes away and the joints become extremely rough and with lots of friction, which makes their movement very painful and difficult. Rheumatoid arthritis is a chronic illness that damages the joint and causes swelling. The joint often deforms. It occurs in the fingers and the wrist. The joint becomes deformed and the person is not able to move. The person is not able to bend the fingers or the wrist. Gout. It's a painful condition where crystals from the body collect in the joint, causing severe pain and swelling. This usually occurs in the big toe. So gout usually is because of diet. So what happens is that, even people who have very high uric acid, you will see that their legs swell. So basically what happens is that certain salts go and they deposit in the joint, which makes its movement impossible. And you can usually see it in the big toe, it swells. Viral infections, rash, or fever may make the joint movement painful. Injuries such as broken bones or sprains. Injuries such as broken bones or sprains can also cause a joint pain. Now, how can you treat a joint pain? So, rest, diclofenacs are the best way to treat them. Exercise, walking, swimming, gentle stretching exercise will help. Even when we were talking about cardiac arrest, I told you every day 5 Surya Namaskars is going to keep you healthy, wealthy, and wise. So, every day 5 Surya Namaskars is your key to having a healthy body and a healthy mind. Weight loss may also be suggested to lessen the strain on joints. Medications such as ointments or gels that can be rubbed into the skin over the affected joint area. Diclofenacs are something that really help in case of a joint pain or in case of a swelling or in case of any discomfort in the joints. Now, what is arthritis? So, arthritis is a condition that affects the joints. It typically in arthritis, it causes the deterioration or inflammation of the joints. It is most common in the following body parts: feet, hands, hips, and knees. So, arthritis is where your joint is not undergoing a temporary discomfort, but it has worn out, right? Now, you need an immediate medical help. So, there is a difference between joint pain and arthritis. Joint pain is more of a temporary. It can be cured. It can be taken care of at home. But arthritis is where the structure of the bone, the structure of that joint section has gone off. That structure needs repair. That structure needs immediate medical attention, right? The types of arthritis are osteoarthritis, ankylosing spondylitis or arthritis of the spine, gout, or rheumatoid arthritis. So in this, what happens is it is a extremely severe form of joint pain. So what is arthritis? It is an extremely severe form of joint pain where the joint is paining because the joint structure has spoiled, right? Joint pain can occur because of viral infection, can occur because of an injury, can occur because of wearing off of the cartilage a little bit. But arthritis is a worn out structure of the joint which needs medical assistance now. You cannot treat it at home. Okay? So it can occur in the fingers, in the feet. You can see over here this gout, in the knees, right? And it is osteoarthritis, ankylosing spondylitis, gout, or rheumatoid arthritis. What causes it? It can be genetic. So arthritis can be genetic. Job or a sport that puts repeated stress on the joints. An autoimmune disease or viral infection can also cause arthritis. So it is genetic as well. This is the difference between joint pain and arthritis, that arthritis can be genetic. It can happen, even repeated joint pain can cause arthritis. Repeated joint pain of the same area and you have not taken care of it can lead to arthritis. So basically you can say that in simple words, arthritis is an advanced form of joint pain, right? Then, what are the symptoms? Extreme pain, redness, stiffness, swelling, tenderness, and warmth that you feel in your joints is something that is indicating towards arthritis. And here I have a couple of questions based on arthritis and joint pain. Which of the following is or are not due to the hormone? So which of these is not due to a hormone? Diabetes, arthritis, gigantism, reflex action. Now I know that diabetes mellitus is because of the undersecretion of insulin secreted by the pancreas. Gigantism is due to oversecretion of growth hormone by the pituitary gland, and reflex action is something which is controlled by a hypothalamus and certain hormones of the adrenal glands. So if I look at all of this, I think arthritis is only something that is not controlled by hormones, because it is an advanced form of joint pain which can happen because of a family history or because of a repeated stress or certain viral infections as well. So that is absolutely correct, that arthritis is a disease of joints. It is the swelling and tenderness of one or more joints A pain in the joints and stiffness that worsens with increasing age is one of the main symptoms of arthritis. There are different types of arthritis with different causes. Reflex action is an immediate involuntary reaction in response to stimulus. It occurs through the reflex arc and blah 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 whatever. So that is why your arthritis becomes the correct answer. Next question is, arthritis causes a pain and swelling of the joints or the muscles. Where do you feel the pain? Is it in the joints or is it in the muscles? In case of arthritis, obviously it is an advanced form of joint pain, and that is why joints becomes my correct answer. So joints is the correct answer. The two types of arthritis are observed in the human body, osteoarthritis and rheumatoid. Common arthritis can be characterized as the inflammation of joints. They are places where two bones meet. These help in the movement in the body of a human. So that is all about your arthritis. And what is the difference between joint pain and arthritis? So we know that joint pain is temporary. It can be taken care of using ointments, using gels, or visiting a doctor, or basic stretching and all that. But arthritis is a very extremely advanced form of joint pain. So arthritis can happen because of family history, because of repeated joint pain, or it can also happen because of some kind of an infection, right? So yeah, so basically guys, you have to make sure that you're taking care of your body inside out. Regular stretching, exercise, good diet, being mentally healthy, having a good social life is something that is going to help you in the long run, right? So with that guys, we come to the end. I hope you guys enjoyed this session, and if you did, do not forget to give this video a big fat thumbs up. Do share this super informative video with your friends and everybody whom you know, because it's quite interesting, and subscribe to the channel because I come every day from 5:30 to 6 with beautiful episodes of Curious Minds, which I'm sure you are liking. And do let me know in the comment section what more do you want me to discuss on Curious Minds. And until we meet next guys, this is Pritesh, your host, your dose, and a proud educator from Embibe, signing off for now. Take care of yourself, stay healthy, stay happy, stay blessed, and do not forget to keep imbibing. We believe in you.
Keep imbibing. We believe in you.